Hello, good morning for most folks, but wherever you're joining us from, welcome to today's webinar, again, on firsthand experiences and regional perspectives from the 2021 Pacific Northwest Heat Dome. As I mentioned, this webinar is hosted by the Collaborative on Extreme Heat Events. Before we get started, some Zoom housekeeping. You may have noticed that this session is being recorded and closed captioning is enabled. Given the size of the webinar, we're going to be muting all participants at this time, and then we'll get started. I'll explain a little bit more. We're going to have the chat open right now so that folks can introduce themselves. But my name is Resham Patel. I use she, her, or they, them pronouns. I'm on faculty at the University of Washington School of Public Health and part of the leadership for the new Center for Disaster Resilient Communities. I'm honored to serve as a co-lead for this project and excited to see so many folks here on the line. It's really great to see the numbers even climbing. As I mentioned, I think the chat may still be open here right now, so feel free to add your names, your organizations, and the jurisdictions that you serve into the chat. We will be closing the chat when our speakers start their prepared remarks and presentations. However, there's also a question and answer feature that's enabled, and it's going to remain open so that you can submit questions at any point. We'll have time for panelists to respond after their presentations as part of the panel discussion. Okay, so I see folks are using the chat, so go ahead, perfect. Add your name, your organizations, your locations. That's wonderful. Really appreciate seeing the range of where everyone is from. All right, so we appreciate everyone joining us today. As I mentioned, the webinar is going to focus on these firsthand experiences across the region. I'm going to provide some context on how this came about before we jump into the presentations today. So what is this collaborative all about? Well, it started from interests from public health practitioners across our region, many of whom you'll hear from or you see on the screen here today. They wanted to learn more about what their counterparts had experienced during the 2021 Heat Dome event and the subsequent calls for action and response. More importantly, they wanted to learn and partner on what it meant for their climate change and health programs moving forward. So while the name of the collaborative and the focus of today's webinar calls out extreme heat, it's the hope of the project team to be establishing partnerships and encouraging action on climate change and heat beyond climate change and health beyond extreme heat alone. The University of Washington's new Center for Disaster Resilient Communities partnered with those practitioners to design a project based on these ideas. And with support from Urban at UW's Research to Action Collaboratory, the project was launched this summer. A small initial planning group of partners from King County, Washington, Multnomah County, Oregon, and Vancouver, British Columbia, along with the University of Washington, convened to refine the project design. And the collaborative network building itself is now beginning and growing with all of you here today. So again, welcome and great to see all the introductions coming in by way of chat. So go to the next slide to describe a bit of how we hope to achieve this. The goal of the project itself is to encourage peer sharing of challenges and innovations and to establish a collaborative network of broad range of transdisciplinary partners that we know are critical to the success of this work. While public health practitioners help launch this project, we know that it's going to take a number of partners and perspectives from a broad range of sectors and disciplines across academia, practice, and community to be successful. And we're delighted to see many of those perspectives already represented here today, and we're eager to see how we can continue to grow as we move forward. Together, this spring, we're going to co-develop a list of actionable recommendations and a research agenda for the future, and opportunities to keep the collaboration continuing. As someone who only recently shifted from practice to academia, I know how important these partnerships can be, but how infrequently they're prioritized. So I'm personally excited to see how we can collaborate, and I'm committed to making sure that practice and community perspectives are driving this work. So on the next slide, you'll see some of our upcoming activities, which highlight how we're going to go about doing this and what the year ahead looks like. This webinar is the first in a 4-part series in which practitioners will share their unique perspectives and engage in discussions based on a shared incident in our region. This will serve as the basis for the rest of the series, which will dig deeper into how this incident intersects with three key themes that have significant implications for future extreme heat events, as well as application to climate change and health more broadly. Notably, our next webinar is scheduled for January 18th, and will focus on early warning systems for extreme heat events. We'll be putting the link in the chat so that you can mark your calendars and register. In February, panelists from across the region will dive deeper on extreme heat and built environment. And in March, presenters will speak about extreme heat incidents and community partnerships. I'm personally really excited for that one. In the spring, we'll be convening representatives from a range of disciplines to participate in a half-day virtual workshop where they'll engage in facilitated discussions to co-develop an action and research agenda that I mentioned earlier. Following today's webinar, you'll receive a short questionnaire that includes an opportunity to indicate if you'd like to stay connected to the collaborative in the future. So whether you're only able to join us for today's webinar or will be participating in future activities, we're really excited that you joined us today. So going to the next slide, I'll just say that that's a little bit of context for today's webinar and where we're headed. And I'll turn it over momentarily to our speakers from each of the three regions, who will each have roughly 10 minutes to share their perspectives on the 2021 heat dome. After which, we'll have a panel discussion that's driven by questions submitted from the attendees of today's webinar. A reminder that we encourage you all to please use the Q&A feature to submit a question for any of the speakers as we move along. As I noted, we'll be disabling the chat in just a few minutes as they share their prepared remarks. So if you haven't introduced yourself yet, or if you just joined the line, feel free to add your introductions into the chat now, and we'll be closing that in just a minute or two. Following the question and answer panel discussion, we'll enable a breakout rooms feature, which you can use to continue conversations with specific speakers. Think of this like going up to speak to someone in person. So looking at the next slide, I want to say with framing today's presentation is around the Pacific Northwest heat dome, which took place from late June through early July of 2021 and had severe impacts across Oregon, Washington, Idaho, and British Columbia, as well as neighboring jurisdictions. Individuals and communities across the region, especially those who too often are most disproportionately impacted during disasters due to systemic and ongoing marginalization and inequities, faced record temperatures in a region that was not designed for or accustomed to extreme heat at this level. The incident led to adverse health outcomes, including heat-related illnesses such as heat strokes and notably excess deaths. Young children, older adults, pregnant people, those with chronic health conditions or working outdoors, and unhoused individuals were most at risk during this incident and continue to be for future extreme heat events. Practitioners, community partners, and others from jurisdictions throughout the region had to quickly respond to unprecedented emergency call volumes, and the incident caused significant strains on healthcare systems, infrastructure damages, negative socioeconomic impacts, and as mentioned, unfortunately, hundreds of heat-related excess deaths across the region. And all of this occurred in the context of a global pandemic, which presented yet another layer of complexities to navigate and need for innovations. For example, in some jurisdictions, this included needing to modify cooling strategies to adapt for social distancing and indoor ventilation guidelines. It also relied on different roles and relationships between governmental agencies and communities, as we've all seen shift in recent years. But we'll go to our next slide. You didn't come to hear from me. So with some of that context in mind, I'll now turn it to our speakers to share their unique experiences and perspectives. We're delighted to have such talented and amazing perspectives on the line here today, and so glad that you've joined us. We encourage all of you, as I mentioned, to please use the question and answer feature as we move along. And so with that, I will turn it over to our first speaker, Jamie Emert, Emergency Preparedness Planning and Partnership Manager at Public Health Seattle and King County. Jamie, the virtual floor is yours. And we'll go ahead and shift to getting started. Thank you all for joining us in what I hope will be a very exciting first webinar in this series. Go ahead, Jamie. I know I saw you unmute there, and hopefully folks can see the slides here. So when you're ready, we'll be all
Okay,
ears.
can you hear me? All right, finally working. Thank you. Good morning, everyone. My name's Jamie Emert, and I
Give it
was
another
asked to...
second, but Jamie, just so you know, I see your.
Yes? Sorry, is there an issue?
Jamie, I can hear you, and I know your camera isn't working today, so we're not expecting you to come on camera. So go ahead.
Thank you. Yes. Yeah, apologies. My camera broke last week. It's still not fixed, so I will be videoless this morning. But I am grateful for the opportunity to share with you today my personal story about working for Public Health Seattle and King County during the Pacific Northwest Heat Dome of June 2021. To acknowledge the land on which I currently reside, I join you today from a location on the traditional land of the first people of Seattle, the Duwamish people, and honor with gratitude the land itself and the Duwamish tribe. Let me go ahead and go on to the next slide, please, Mariana. Thank you. Okay, so for the presentation today, I'll cover a bit of background about the public health considerations during the heat dome for our area, look a little bit at the data about impacts of extreme weather, particularly using emergency medical services data, which is the area in which I worked at the time, and also mention a few larger King County public health blueprint for addressing climate change and health. There are some web links and resources in the presentation if any folks wants to follow up on that, happy to provide that. I'll just say that the content of this presentation would not have been possible without members of Emergency Medical Services, Emergency Preparedness, Environmental Health, the Department of Natural Resources and Parks, and our multidisciplinary King County Climate Health Action Team. So thanks for all the individuals that I can't name in this presentation today for their work towards this. All right, next slide, please. Okay, so as Rachel alluded to, from June 26 to July 2nd of 2021, the National Weather Service in Seattle reported a long duration, unprecedented heat wave through the Pacific Northwest. The image on the right side is a temperature map from the National Weather Service on June 28th. This extreme heat event resulted in high to very high risk of heat-related impacts and illness for much of those in our local population, especially to those who are heat sensitive and those without effective cooling or adequate hydration. As you may know, hotter temperatures increase the risk of illness and death from heat stroke and various respiratory, cerebral, and cardiovascular diseases. Heat-related health risks in King County are exacerbated by existing inequities in housing, access to healthcare, and health outcomes. Those most at risk are older adults, the very young, pregnant women, people who work outdoors, people who are unhoused, and people who have chronic medical conditions. Many of the areas affected by higher temperatures are the same areas who've been disproportionately affected by COVID-19 and other health inequities. All right, next slide, please. So just a few days prior to the heat dome on June 23rd, King County and City of Seattle actually announced results of a groundbreaking heat mapping project that quantifies the harmful, inequitable impact of hotter summers in our region. The data showed that surface level temperatures in areas with paved landscapes, less tree canopy, and industrial activity are substantially higher during summer heat events compared to less urbanized areas. And more urbanized areas were as much as 20 degrees hotter than less urbanized areas, due in large part to that land use and land cover. Next slide. So it's if the extreme temperatures weren't enough of a challenge at that time, several wildfires started in King County and the surrounding area. The biggest health threat from smoke is fine particles, which can penetrate into lungs and cause a range of health problems, including burning eyes, runny nose, that can aggravate chronic heart and lung diseases. So air quality alerts were issued simultaneously with the temperature warnings. The image on the right is an air quality alert map using data from the Washington State Department of Ecology and published in the Seattle Times. I should also note that sometime during heat events, there can also be a buildup of ozone in the Cascade foothills, typically as a result of air stagnation, less crosswinds, And that tends to build up and linger in the foothills, and then it can sort of convert industrial emissions to ozone. The Puget Sound Clean Air Agency almost had to issue an alert for ozone in particular, but there was already alert for wildfire smoke. So it kind of all got wrapped in to the various alerts that were happening at the same time. Next slide. So there was also, this is a snapshot of what was happening with COVID in King County at the time. There's a screenshot of our COVID case counts. There was a tapering effect from a surge during May, and there was a lot of hope that in the summer months we could potentially return back to normal, whatever normal might be. Unfortunately, in the next couple of weeks, the Delta variant was actually ramping up, and hospitals continued to experience staffing shortage, high emergency department volumes, and staffed bed capacity challenges for their ICU and acute care. Next slide, please. So the preparedness team at Public Health Seattle and King County had available a heat response plan on the website that various community members potentially could use. And they were already activated for COVID, but they did an enhanced activation to include the heat response activities. And for those who don't know, our emergency support function 8 version is called the Health and Medical Area Command. So you might hear me refer to it as HMAC. And they help to coordinate public communication to public as well as internal public health department activities that support the heat response. Next slide. So this is an example of the type of messaging that the public health communications team had put together. They did multilingual messaging, paid ethnic media campaigns, and social media informational campaigns. This stays safe in the heat comic book image that you see on the right. It was shared via the Public Health Insider blog. And I should note that per King County policy, this was translated in the most common non-English languages in our region. And the image itself shows a patient being wheeled on a gurney from an ambulance into a hospital emergency department. And the caption reads, "On hot days in King County, many more people have serious health problems." Next slide. The preparedness team also posted a brochure and made it available in several non-English languages. The brochure advised individuals to stay cool, stay hydrated and informed, and they recommended checking local news for health and safety updates. Next slide. So about my role in this event, at the time I was in West Seattle, and due to COVID, there was a reduced metro transport, like bus transport routes in West Seattle because of a bridge closure. So there was just a major transportation corridor that was shut down because the bridge had cracks in it and they were doing emergency repairs. So my telecommuting site mostly was at home for the transportation and COVID reasons. We live in a 1970s home that did not have air conditioning, so there were personal heat mitigation activities that we had to do here. And also I had to support a team who was working in the Division of Emergency Medical Services, a team of epidemiologists and managers, and their responsibility was to analyze data that was collected from 911 dispatch centers, 25 fire departments, 5 paramedic agencies, and local emergency departments using a hospital data exchange. So when HMAC activated for the heat response event, I received a communication asking for my support of that activity, and particularly in the form of data. So we'll go on to the next slide, please. Okay, so on Friday, 2 days prior to the peak of the heat dome, the EMS division received a request for data related to heat-related illness, drowning events, and other larger EMS system impacts. I'll say within a few hours, our team developed a definition of heat-related illness and started putting together some of these dashboards. And then over the weekend, I ran these dashboards multiple times a day and provided updates as requested. And that information was actively pushed out to our communications folks as well. So this graph shows a demand for EMS services during the heat dome. It looks at all basic life support and advanced life support services. So BLS is the blue bar and advanced life support or paramedic is the red portion of the bar. Between June 22nd and July 4th, on average, EMS agencies respond to about 500 to 600 medical incidents per day. And with the increased heat, there was definitely an increase in the number of 911 calls. So at the peak, there were 700 incidents on June 26th, 800 on June 27th, and the peak was 1,200 incidents on the highest heat day of June 28th. That did set a record for the largest number of EMS calls. All right, next slide. Thank you. To try to manage the demands for individuals calling 911, a lot of our EMS personnel were experiencing very little downtime. There is a service of mobile integrated health to help folks connect to additional services in a more non-emergent fashion. Unfortunately, MIH programs had to be suspended or had very limited staffing capability because they were just getting such a large volume 911 calls. So this was a quote and a screenshot from a Seattle Times article about the event. Next slide. This type of response was seen previously. There is a great EMS article that was done looking at data from 2007 to 2012. It's in alignment with what happened during the heat dome. So if you want to read through that, then we can provide that at the end of the presentation. Next slide. So looking a little bit closer at the heat-related illness as the main reason for EMS calls, this is a bar graph just looking at that one condition. And you can see maybe before the heat dome event, there might be one, maybe two EMS responses for heat-related illness. And on June 26th, there was a major increase for a total of 50 incidents, followed by even higher counts, 78 on June 27th, and a peak of 237 incidents on Monday, June 28th, corresponding to the highest heat day. And on that peak day, over 30% of those heat-related illness events required advanced life support or paramedic services, which is an increase from a typical distribution of only 1 out of 4 or 5 EMS responses needing ALS level care. Next slide. Yeah, so with those ALS level services, typically there's larger staffing required in the field for those events. And EMS personnel, we received direct anecdotal reports from personnel where they experienced occupational risks due to the heat. For example, one firefighter reported just walking into a building, it was 130 degrees Fahrenheit in the building itself. And another paramedic who was providing CPR reported receiving contact burns from kneeling on the pavement trying to administer CPR. Next slide. We did look at geographical distribution of heat-related illnesses. They did sort of fall in line with the heat mapping project shown earlier. There were higher volumes of heat-related illness in the south areas and in downtown Seattle, where it's less tree canopy and more of a concrete structures. Several of our emergency departments reported nearing crisis levels, particularly for acute care patients requiring specialized equipment such as ventilators. So definitely there was an overall system impact. Next slide. Okay. As a result of this heat dome and the significant impacts experienced on the emergency medical system, EMS, we became involved in understanding this blueprint for addressing climate health change and joined the Climate Health Action Team as an active contributor. Just a quick time check. How are we doing on time? I can't remember when we started.
You're doing all right, Jamie, but it'd be great if we're kind of nearing the home stretch.
We are.
Speaker. Great.
Yep. 1 more minute. Okay. We'll go on to the next slide. So after the heat event, our local health officer, Dr. Jeff Duchin, they published an insider blog, and during that he quoted, The record-setting extreme heat we just experienced is the latest example of our climate crisis, and climate change is a health emergency. Next slide. And just a reminder that these health risks and impacts are not equally or fairly distributed across people or communities within our area. And last slide, I will say I'll end here. For this reason, our King County Executive Dale Constantine highlights that on his webpage that climate change is one of the paramount challenges for our generation and generations to come. It's happening now. So I can't speak to all of the work that's being done across King County on this effort, but this is one glimpse of the story that I can offer from my experience in emergency medical services at the time. I hope it's useful for you. And there is a little bit of a summary, but just the gist of it is major EMS system impacts. On the next slide, you can see it. There are major system levels almost led to crisis levels, and these are likely preventable. So I will go ahead and end there. Thank you for the opportunity to speak. Again, hope this is useful, and glad to be a part of this effort. Thanks.
Thanks, Jamie, and thanks for kicking us off with those personal insights and setting the groundwork for what we experienced across this region. I think you're seeing the themes starting to hopefully build. And so with our next speaker, I'll turn it over to Brendon Haggerty who's the Healthy Homes and Communities Manager at Multnomah County Health Department. I think we'll be pulling up some slides or turning the screen over to you, Brendon.
Thanks, Rachel. And thank you, Mary Hannah, for getting the slides up. Hi, folks. My name is Brendon Haggerty. I use he, him. And I'm joining you from Multnomah County Health Department, which is the local public health authority for Portland, Oregon. I manage a team in the health department that focuses on health impacts of climate change. And as we were just hearing, in 2021, the Northwest experienced those impacts in dramatic fashion. And so I'm going to talk today about those few days in June when life kind of stopped as we experienced those staggeringly high temperatures that we really haven't documented before in this part of the world. And I'll try to do that today from the perspective of someone responding in a local health department in Portland. And the next slide is just a chance to introduce Multnomah County a little bit to those who may not be familiar with it. It sits at the northern border of Oregon at the confluence of the Columbia and the Willamette rivers. It's geographically small, but it's home to about 820,000 people living in Portland and the nearby suburbs. And it rests on ancestral lands of the Multnomah, Cathlamet, Clackamas, Chinook, Tualatin, Kalapuya, and Molalla peoples. Like Seattle and Vancouver, hot weather is pretty unusual for us. Over the past couple of decades, we've averaged just a few days of year when temperatures reach above 90 degrees Fahrenheit. And also like Seattle and Vancouver, air conditioning is far from universal. I think in the most recent surveys, we saw that in the metro area, it's an estimated 1 in 5 homes do not have air conditioning. So we're used to modest heat waves here. And historically, we have modest responses to those modest heat waves. Before the 2021 heat dome, our cooling centers were basically extended hours at senior centers or county buildings, and those would often have just single-digit attendance. So for most people, hot weather might mean a trip to the movies or a swim in the river, but not a trip to a mass shelter. In most years in Multnomah County, there are 0 heat deaths. And before 2021, the highest count in the past 20 years was 2 hyperthermia deaths in a single year. So while we don't have a long history of dealing with extreme heat, but it's not as if we didn't see extreme heat coming. We have a standard operating procedure for extreme heat events that includes risk-based thresholds and a menu of evidence-based interventions. We have communications infrastructure in place with a dedicated web page and an interactive map of cooling spaces. We also have a dashboard set up for syndromic surveillance during heat events so we can monitor in real time visits to emergency room and urgent care clinics. But even though we had all of that in place, it wasn't enough to prevent really severe health impacts in June of 21. On the next slide has a little bit of a chronology. And I think this is similar to what happened throughout the Northwest, but I'll share some Portland specifics, and hopefully this jogs folks' memories. it was so anomalous. It was just so anomalous. We broke all-time heat records by something like 9 degrees Fahrenheit, reaching 116 degrees Fahrenheit or 47 degrees Celsius in Portland. And how that unfolded in Portland entails this critical piece, which is that the forecast was consistently revised upward. So when we began outreach on Monday, June 21st, the Weather Service was reporting, or forecasting, I should say, around a 20 to 30% chance of temperatures over 105 degrees Fahrenheit. So we mobilized expecting something closer to the garden variety heat wave that we might experience once or twice a year, rather than the record-setting heat that we got. But when we fully activated on Wednesday, the 23rd, the Weather Service had just issued an excessive heat watch to begin that following Friday. And on that day, the 23rd, we convened a coordination call with 144 organizations and jurisdictions, everyone from first responders to housing providers, transit agencies, and utilities. Forecast was revised again on the 24th with a record high of 109 degrees being forecast for Sunday. And with that forecast, we decided to open libraries as cooling centers in addition to the convention center and the community centers we had already identified. Overnight sheltering started on Friday the 25th, and it got hot. And on that day, we learned that the high temperatures expected on Sunday would be repeated on Monday. Saturday, the all-time record was broken for heat, and we gained support from the Red Cross in staffing and supplying our cooling centers. Sunday, we broke the record again on the 27th, hitting 112 degrees Fahrenheit. We opened additional library branches as cooling centers. And by this point in the event, it was my role to do syndromic surveillance. And when I began to see reports of people ending up in the emergency department after being found prone in their yard or on a sidewalk, it became clear just how severe this event was going to be. And on Monday, the 28th, when we set what would become the new all-time heat record of 116 degrees Fahrenheit. Nighttime lows remained high on Tuesday night, and we finally closed cooling shelters on Wednesday, June 30th. The next slide shows an image of part of our response, which was truly unprecedented. I mentioned we had a menu of interventions, and we used every single one of them that we had in our plan, and we had to improvise some others. We had warning messages translated into 7 languages and distributed through as many channels as we could think of. And for the first time ever, we opened 24-hour cooling shelters, recognizing that nighttime lows in the 70s and 80s would not provide adequate recovery. The shelters were resourced with behavioral health specialists, food, pet accommodations, and COVID vaccination. Anyone who needed transportation could get a free ride on transit or call 211 to arrange a ride. And as Jamie mentioned, this happened in the context of COVID. So we were basically having to reverse our messaging that we had been saying for more than a year to avoid being indoors with others. We ultimately sheltered 1,400 overnight guests and provided 6,000 meals. There was an incredible amount of direct outreach to vulnerable populations. Our case managers were working furiously to check in on older adults and people with disabilities. And we had 100 street teams conducting outreach to people living outdoors, distributing cooling kits, water, and cooling towels. We also had a strategy of contacting property managers in multifamily buildings, starting with affordable housing providers to ask them to open cooling respite spaces and share information about cooling centers. Slide 4, the next slide, gives you a slice of how seriously altered life in the city was during this time. In this photo, you can see the overhead cables for our streetcar lines were melting during the heat, and rail transit had to be suspended. The Parks Bureau canceled permits for outdoor athletic events, and our transit agency, TriMet, transported people to cooling spaces for free. Even the pools were closed because the decks were too hot. On the next slide, you can see that despite our best efforts, the health impacts were swift and severe. This time series shows emergency department visits for heat illness during the summer of 2021, and you can see the dramatic spike during the week of the heat dome. In a typical summer, we might see around 80 visits, but over those 5 days in June, we had about 2 summers worth. And just as we saw in Seattle, our emergency medical services were as stressed as they were at any point during the pandemic. The next slide shows that there were yet more severe impacts. During 2021 in the summer, we lost 72 community members to heat. Before this event, as I mentioned, heat deaths were almost unheard of in Multnomah County. And in a typical year, we would expect 0. In this time series, you can see that the highest daily count occurred the day after Portland posted a record 116 degrees heat. And our medical examiner continued to find heat death cases well into July. It was shortly after this, maybe the next week, the week following, that I returned to the office. And in my office, we have our vital records team who processes death certificates. And when I arrived in the office, I found them kind of circled together, sharing tears, because they were seeing the stories in these death certificates of people who, in their words, could have been their loved ones or themselves. And during a pandemic that had already been hard on this group, it said a lot to me about how deeply this event impacted public health staff, not just in response, but people throughout the organization. The next slide shows some groups that were disproportionately represented among the decedents. And I think this is pretty common, probably among the jurisdictions represented here today. But I'll just point out that the most severe outcomes were affecting people who are older, living alone, living in multifamily buildings, and in warmer parts of the county. But on the next slide, I can share some good news, which is that fortunately there have been some really significant positive changes that have taken place since the heat dome. And we are on our way to becoming much more resilient to heat. Some changes to our operations happen right away. We strengthened partnerships with other jurisdictions and improved our sheltering operations. And instead of our emergency manager buying every paper plate on the shelves of the supermarket and stuffing them into the back of his car, as you can see in this photo, we now have a warehouse and a distribution system with supplies ready to go to cooling shelters. We've also changed how we get our briefings from the National Weather Service. They've been great to work with. So realizing that we need to be prepared not just for the most likely scenario, but the worst case, our conversations with the Weather Service now focus more heavily on the probability and the chance of an extreme event. We've had a wave of new cooling resources become available. Anyone on Medicaid in Oregon can ask for air conditioning from their doctor. And the administrators of those programs have worked hard to make that as low barrier as possible. The Portland Clean Energy Fund, and shout out to the folks from Earth Advantage who are here on the call today, which is a tax on large retailers in Portland. They've diverted some of their revenues to provide 15,000 heat pumps and air conditioning units to low-income households. That's accompanied by new programs from the state and county governments that also provide air conditioning to low-income families and the community buildings that serve them. But also a few policy changes that are cutting edge, I think, even among states that experience heat really regularly. So after the heat dome, the Oregon legislature passed requirements that starting next year, new construction will include spaces that can be maintained at 80 degrees. We also have a new set of OSHA rules protecting workers from extreme heat. So I think with that, I want to thank the other presenters and the audience, and I will pass it to Rachel and Michael.
Excellent. Thanks, Brendon, for those context for Multnomah County and those touching remarks. I know the personal stories and the weight of everything that folks on your team and other teams in practice were carrying during that time. Really compelling and an important reminder of the human element of all of this. With that, we'll turn to our third presenter and final speaker for prepared remarks, Michael Schwandt. Michael is the Medical Health Officer at Vancouver Coastal Health, and I will turn the floor over to you, Michael.
Thanks very much, Resham, and thanks to the previous speakers from King and Multnomah counties, as well as everyone who's joined the discussion today. I see a lot of familiar names, folks that we've worked with in and around Vancouver, and a lot of new names as well. So I look forward to meeting and talking with you too. If we can move to the next slide. Just wanted to acknowledge the land I'm presenting from today is on the traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations here. Vancouver Coastal Health actually operates over a geography that includes 14 different First Nations. Given the role of colonialism and systemic racism in both climate change and the inequitable impacts on Indigenous populations, certainly in Canada and elsewhere, I think it's important to proceed with a spirit of reconciliation when we discuss this topic. Next slide, please. Just a bit of a background on Vancouver Coastal Health. As well as serving the city of Vancouver, this is what we call in BC a regional health authority. So this is one of 5 regions within the province. We serve about 1/4 of the province. This includes the city of Vancouver, a number of neighboring cities, as well as towns, rural areas, and First Nations across parts of southwestern BC and up into the central coast of the province. So as well as delivering public health services, this is also the health authority that delivers hospital services, primary care, and a number of other health services within our health system. So kind of geographically functions at a county level for our US colleagues. Next slide, please. Now, it's already been well characterized by the previous speakers, but these temperatures recorded here in Celsius absolutely smashed records within southwestern British Columbia. People who've lived here for a while will know that temperatures starting with a 4, temperatures in the 40s or over 104 Fahrenheit are almost unheard of in this part of the country. Temperatures in the 30s, in the high 80s or 90s, not even very common at all. So this was really just records broken right across our region. Next slide. And tragically, this did lead to a large number of deaths within our province. A coroner's report that was released sometime after the heat event had found that 619 deaths were attributable to heat, either as a sole or contributing factor to deaths within our province. So this is really a tragic and catastrophic toll. Next slide. There was a report that was developed, and I'll pull some findings from that for this discussion today. Our coroner's office, which is a provincial institution, convenes in extraordinary circumstances what are called death review panels. So these have been applied to issues like this, as well as the drug poisoning crisis within the region for really severe and important cases. Next slide, please. Some of the findings here were, as well as the fact that there were 619 heat-related deaths within our province, 145 of those were within our own health region and 117 within the city of Vancouver. Most of the impacts were in the southwestern part of the province, in the larger cities, although certainly with a number of important impacts in rural areas as well. The overwhelming majority of deaths occurred indoors, as was described previously. This was a contrast to risk that we've been trying to characterize at the time related to COVID-19. In many cases, the risk was due to high indoor temperatures in people's residences rather than out in public spaces or outdoors. Most, but not all, of the people who passed away as a result of extreme heat did live alone, and we had wide reports that were described and then later characterized quantitatively of our paramedic service, our ambulance service being overwhelmed, even collapsing in some areas, and long delays in the emergency room too. Next slide, please. As well as the tables and figures that you might expect from a report like this, the coroner's report did describe in a narrative way some important issues that I just wanted to elevate here. Again, most of the people who passed away, as described here, were elderly, older adults, socially isolated in many cases, as well as having chronic medical conditions. So we see this intersection of medical risk with social risk factors as well, with chronic diseases, both mental health and others being highlighted among those. Very importantly, it was noted that most of the people who passed away lacked access to air-conditioned space, either within their own home or that they were able to move to for refuge. Next slide, please. And the inequity in the distribution of these health impacts is really quite stark. This is a figure describing the rate of emergency room visits on a per population basis across neighborhoods of the city of Vancouver, as well as neighboring cities, Richmond, West Vancouver, and North Vancouver. And you'll see here a 10-fold difference in the rate of emergency room visits for heat-related causes in the downtown area that includes our downtown east side, compared to, for example, the Kitsilano neighborhood of on the west side of Vancouver or others. You see as well impacts in North Vancouver and the southeast part of the city. Many people will know that the socioeconomic factors that affect our region and the distribution of green space as well map unfortunately quite well to this risk. So these are inequities that flow from fairly well understood risk factors. Next slide, please. I wanted to describe, as well as some of the quantitative data, some findings from qualitative findings. So this is a report developed by what's called the Climate Action Secretariat for the province of BC. And they had conducted, after the heat dome, focus groups, interviews, sharing circles, and other means to develop qualitative information on people who had direct experience of some of these increased risks that I've described. And then on the next slide, not having too much time to bring out all of the different themes, one very important one that I wanted to highlight for this group was just the risks related to housing and material deprivation as related to extreme heat. So we have here a participant, an older adult, describing that they're simply unable materially to afford air conditioning for their home. They expressly describing that they might be able to do that, or that they'd be interested if they had some sort of support for even some portion of that. And then over here, another person, a service provider to people at risk, describing that they've heard from patients, clients, participants in their program, that in many cases, even aside from that material cost, that in many cases buildings, landlords, and people's housing conditions actually prevents them from adding air conditioning to their home. So using or installing an air conditioner coming with the threat of eviction in a very precarious housing market right now in our region. So these are, I think, very important notes that have both affected the risk during the heat dome and also inform our actions going forward. Next slide, please. Now I'll describe some actions that have flowed from the heat dome event in terms of the recommendations. I'll use this report as a framework to organize those. There are 14 recommendations from that death review panel that I mentioned in 3 key areas. 1, looking at the provincial heat alert response system. 2, identifying and most importantly supporting at-risk populations. And 3, longer-term preventive strategies that were described by these recommendations. Next slide, please. In terms of the heat alert response system, it was widely described during the heat dome that the communications, whether through the media or directly from health authorities and other institutions, were inconsistent. The language that was used didn't always characterize the risk as severely as it ought to have. And that overall that the coordination needed to be improved. We have had within the southwest part of this province and 2 of our health authorities, Vancouver Coastal Health and Fraser Health, a heat response plan. Candidly, it's probably not well enough socialized over the years, not well exercised in recent years, in particular during the pandemic. So there's a real push at a provincial level to, 1, form a committee that would be responsible for and accountable for planning and the response to future heat events. And as you can see in this list, this involves a multi-sectoral set of partners. And then as part of that committee's early work, developing a heat alert response system that had consistent trigger levels in terms of temperature specific to the different regions of the province, because we have different risk across the province with very different microclimates, and then with very clear steps for different partners to take at these levels. Next slide, please. Related to this plan, it describes a number of evidence-based actions and best practices to support planning and action during heat events. Really, we want to make sure that people across communities, whether you live in the city of Vancouver or in a smaller rural community, are going to be able to see a similar and a high quality response to heat events. So this heat alert response system describes these good practices. It's not meant to be prescriptive. It's meant to be a set of recommended practices, recognizing that different communities, again, I described both large cities and small towns, will need to implement these differently and in a way that's appropriate to the communities that they have expertise in. But this does provide a common playbook for not only city governments, but also the health authorities themselves, for government ministries, non-governmental partners as well to follow, and hopefully be working from a similar system. The next slide. Moving to the next pillar of these recommendations from our coroner's report, this idea of protecting at-risk populations in a better way. We've really tried to increase, as a regional health authority, our ability to partner with community organizations from the not-for-profit housing sector to organizations that are delivering services to groups that are at increased risk during heat events, trying to support those programs, both with public health technical advice and expertise, as well as in some cases with funding where that's possible, either directly from the health authority or trying to identify and mobilize that from other parts of government. As well as that, we have a provincial program to distribute air conditioning to at-risk households that began to be implemented last summer. Move to the next slide, please. I'll describe this heat check-in support framework. We received a lot of feedback from community organizations, a lot of positive notes, including the not-for-profit housing sectors that I had mentioned, that organizations and staff had taken it upon themselves to begin to reach out to people, to conduct that sort of community outreach that was described by previous speakers, looking to people who might be at increased risk, trying to help them to cool off in their homes, get them to cooler spaces, seek medical advice where necessary. And we received, saw the large opportunity with that, with this sort of decentralized work that was taking place, but also got very clear messaging back to the health system that we needed to provide better advice on who was at risk, more clear direction on what a non-healthcare worker could do to intervene. Because there's a lot of capacity at play. We've learned, but I think the opportunity to enhance and optimize the effectiveness of this work. So this is something we've delivered. Got a lot of positive feedback on this, and as well as producing the document, have worked on trying to take this out into different organizations in a train the trainer kind of format. And we've come to understand that this is being used in the field, but we're always trying to improve this and making sure that this is as useful as possible in the community. Next slide, please. I mentioned this program to distribute air conditioners within British Columbia. This was announced last summer. So this is a funding program. At this point, it's 10 million Canadian dollars that have been allotted to this over a 3-year period to distribute portable air conditioning to people with identified risk factors. I think it's very important to note at this stage, we're early in the program. Public Health is trying to work with the provider of this, which is our provincial power authority, BC Hydro, to ensure that the distribution of this resource is evidence-based, it actually maps to risk it, and it's equitable so that it can have the greatest possible impact over time. Next slide, please. One more pillar before I wrap up, these longer-term risk mitigation strategies, as well as noting the importance of outreach to people during these events, the importance of cooling centers that might be provided by local government or by non-governmental organizations. Of course, the primary prevention at the level of the home, of the household, is really, I think, the key intervention here. So advocacy for safe indoor temperatures in terms of policy interventions is very important to us, and I'll describe that a little bit more. Working with local governments to ensure that the seasonal readiness plans related to heat, as well as wildfires, drought, and other climate-related events are up to date in terms of the current risks and follow good public health guidance, and then better surveillance of these impacts on health, so that we know which populations are being affected. We know the neighborhoods and the individual and population level characteristics of risk, so that we can target our programs as well as possible. Next slide, please. Couple of notes on this long-term prevention. Again, the idea of a right to cool and that we need policies to support that, I think, is really crucial. We've seen some success with this over the last couple of years. Vancouver's building bylaw and recently the BC Building Code have included plans to mandate a maximum indoor temperature of 26 degrees Celsius, which is about 80 Fahrenheit, for new medium and large buildings. So I won't get into the technical categorization, but effectively apartment buildings would have this rule applied to them. So this, we think, is excellent news for new builds. However, we know that a lot of people who are at risk, and a lot of our population, period, of course, will be living in housing that isn't brand new for years and decades to come. So it's very important that we have policies that protect people in that current housing. So that's, might look at the actual relationship between a landlord and a tenant. So policies like the Residential Tenancy Act, standards of maintenance bylaws that affect existing buildings, very important that we attend to protecting this right to cool within the housing context, again, in both existing and new builds. Working with cities and towns and community planners to reduce the urban heat island effects, make sure that cool environments are available, whether that's green spaces or indoor cooling spaces that are accessible and welcoming to people, and trying to design social connectedness into our communities more and more so, seeing how protective that can be amidst climate and other emergency events. And again, continuing to work, building this capacity among community organizations and individuals for mutual support and social connection that can be protective through these events. Last slide, please. A couple of steps, or about 5, that we're continuing to work on. I should mention this ongoing advocacy for thermally safe housing, just how crucial that is, that we make sure that our housing stock is climate resilient in a way that's up to date for the climate change we now expect to see and already are seeing. Climate resilience among community organizations, making sure that they are adequately supported. Many community organizations are funded on a year-to-year basis and have limited capacity to meet the mandates that they already have. So we know that building in that capacity requires more robust long-term core funding for organizations to carry out some of these activities that we've seen great enthusiasm for, great attention to, but very clear input that this does require, in many cases, more staffing and different infrastructure to deliver. Better coordination of the emergency support activities. So when we have both our institutional public health bodies, municipal governments, and local organizations all working together on outreach during these events, trying to coordinate this in a way, for example, with opt-in contact lists that we're able to reach out to and share with other organizations who has been contacted and what people's status is, very important. We had, in many cases, people who unfortunately weren't contacted by any organization we've learned of during the heat dome. And then we've also learned of people who say they were contacted 3 or 4 times by different organizations. So looking at how we can coordinate is very important. And always making sure that we engage people who are at higher risk in this planning. This could include people with disabilities, but other groups, older adults among them, who are at risk, making sure that we're not making plans without the inclusion of the populations, of the communities themselves is, of course, crucial. And then that's the last slide that I had. Thank you so much for the time, and I really look forward to discussing this all together and in our breakout groups as well.
Great, thanks, Michael, and thank you to all of our speakers for their prepared remarks. Thanks for some of the questions that have been coming in and several of them that have been answered in real time. I'll go ahead and shift to our question and answer panel discussion period. Again, thank you for those who've come in already. One of the questions that came in related to 24-hour cooling centers. This was to you, Brendon, and you responded to that. And I think what it brought up is another theme in terms of existing partnerships that you all were able to leverage during this incident. I think one of the questions that we had is, what's one new partnership that may have been developed during this incident, some of you highlighted, or immediately after, that you wanted to really call forward and that you're continuing to cultivate? So maybe a new partner that you weren't working with before that came out of this partnership, this incident. Anyone want to jump in on that? I'll see Brendon if you want to go first. Yeah.
Sure. I think one that I'm excited about is we've been working with the Portland Bureau of Emergency Management and a local affordable housing provider called Home Forward to place temperature monitors in apartments in affordable housing buildings so that we can understand what's going on there. And that informs, we can see that in real time, and that informs our emergency response. It also informs longer term actions, especially on the part of the housing providers who are now, providing air conditioning in almost every unit. But it also includes an engagement component with the residents, where we've learned a lot about behavioral adaptations. And we've just completed our second summer of doing that. So it's been a cool partnership.
Excellent. Thanks, Brendon. Michael or Jamie, was there a partner that you wanted to highlight in terms of a new relationship that was cultivated? I know you mentioned a lot, so no worries if not.
Yeah, there's a number of those folks who are on the line right now. So one I'll take a moment to highlight would be outside of Health and Human Services, but actually BC Hydro, our provincial power utility. They've had a long-term effort in terms of climate change mitigation and resilience to deliver lower cost heat pumps and other interventions, trying to increase the uptake of these technologies within housing, and working with them as I think with this recognition of the co-benefits of both climate change mitigation and moving some of these technologies into households in greater numbers, trying to ensure that the distribution of those programs is equitable. There's been a lot of commentary with some of these programs. So funding people to, for example, renovate a home and add a heat pump is a positive intervention in many ways, but trying to work with them to communicate just how important this could be from a health protection perspective, and just how we need to think of looking at people who are at risk in their indoor environment, at the greatest risk as well. We've actually found a really positive connection. Again, not necessarily the first or even in the first 5 natural partners I would have listed for our local public health authority, but it's been a very positive connection. And certainly the AC distribution program over the last several months has been a really positive start with them.
Yeah, I can go ahead and chime in. This is Jamie. I would say one partnership that emerged after the heat dome that was really important for Public Health Seattle and King County is the National Weather Service partners. The preparedness team worked closely with National Weather Service to develop heat risk indicators and map that directly to public health recommendations and public health actions. That information is available on a website. I can post that in the chat if you'd like to read more about what the National Weather Service heat risk values are and how that ties to our public health connection. But that's what comes to mind for me. Thanks.
Thanks, Jamie, and thank you all for highlighting. I like the way that you brought that forward, Michael. Not natural partners, maybe not the first few that you would think of. And Jamie, to your point, right now on National Weather Service or other partners, and thinking about our preparedness and moving forward, we've highlighted response in this incident, but certainly as somebody who used to work in preparedness and still wears that close to my heart, I think this also highlights the opportunities to evaluate and learn and move forward in a preparedness kind of position on all of this. I think we have several questions that kind of touch on this. You see a note that there was an impressive preparation and response by the city of Portland, and questions about the action plan and how long it was in place, and how that may impact preparedness. There's also questions about trying to get inventory of heating and cooling centers across Eastern Oregon, and trying to kind of think about this from a positive planning perspective. Jamie, just on your last point, I think you put into the chat an answer about the heat mapping project and things that would kind of move forward for planning in other jurisdictions. And then we had a question from colleagues in British Columbia, or a note about breaking down the rates of deaths across various chronic diseases, and wondering if that was true in other jurisdictions and cities in the area. And so I think, there's a number of questions I would say that are coming in, questions about pets and animals living outdoors, lots of thinking about what does that look like. And I guess I'm just wondering if the panelists can reflect on how you're incorporating this, in addition to the things that you highlighted in your prepared remarks, in terms of your preparedness programs and moving forward. So look to you first, Michael.
Sure, thanks. And thanks for that great question there, Jeannie, that I'm seeing on animals. And this note, if you don't mind my repeating what you've put in the chat, you'd stay home and die with the dog rather than leaving for a shelter. This is something we hear from people. The ability to keep their pets, their companion animals safe, and to be with them during these events is very important. People need support during these stressful times, and oftentimes that comes in many different forms. I think this relates to the larger question of cooling centers and cooling spaces, and how we can create not just a cool space within four walls and a roof, but an actual space that people are invited to and feel welcome to spend time in. So looking at the programming of spaces, what's available for, whether that's for older adults, for younger children, and everyone in between. The ability to bring pets to these sites is something that our partners at City of Vancouver and other municipalities have looked at a number of the sites, knowing that that can actually increase accessibility in many cases. And as well as that, places to, I should just note as well, to store belongings has been noted by a lot of our community partners, specifically for people who might be homeless or underhoused, being able to bring one's things to the site and not to feel stigmatized in needing a place to put things, whether that's a large backpack, a cart, or anything else that somebody might have with them. Planning for that as a baseline expectation at some of these sites, rather than an exception that needs to be a special case. All of these are really important things. And so, glad to branch off from your question about animals. And definitely, it's nice to see that that's something that a lot of our partners delivering cooling spaces are attending to quite positively.
Maybe I'll add to that, Michael. I think we offer pet accommodations in our mass shelter sites. And I think, anecdotally, that's one reason that people come in. Maybe less concern for themselves than for their pet. But it's just the case that I think a lot of people don't realize their own vulnerability to heat. So it's a route to reach people. It's through their pets. I also wanted to respond to one of the questions in the list here, just about getting an inventory of cooling centers and heating centers. And I think that's something that we struggle with. In that they change every time, every event. We don't have kind of a set location, which makes it a little bit tricky for people seeking shelter. It'd be a lot more straightforward if they just knew, the library in my neighborhood will always be open, or something like that. But it also makes it hard for us to, analyze in a really prospective way the equitable access to those kinds of facilities. So it makes it hard to provide anyone with just a straightforward inventory, but it has some kind of operational complications as well.
Yeah, Jamie here, I can jump in. I'll say that the question about pets did come up during cooling shelter conversations and trying to understand if cooling centers would allow pets. Some of the shelters did post that pets were welcome, but not necessarily all of them. And it just depends on the shelter itself on what their messaging is. I will say our health department does not actually manage cooling shelters. It's managed by a separate organization that we partner with. So that is when, we often get questions about that. Why was that decision made? And we have to say, well, that's really our partners' decisions. I will say that during the heat dome, we did look at 911 responses to cooling shelters and the impact there. And it just seemed like they were a really effective venue in helping people to, mitigate the heat and stay safe. Yeah, I'll pause there and see if we want to go to another question.
Yeah, I appreciate that. And thanks again for attendees who are bringing forward topics that I think have cross-cutting implications. I'll just note a couple more questions have come in that maybe are still connected to this theme of kind of triggering preparedness and planning on the front end, including one that spoke to a previous heat dome in southwestern BC in 2009. And wondering if this was also felt in Washington and Oregon or other previous extreme heat type incidents, and if that's what may have prompted some earlier action in some of your jurisdictions. So I think just this idea of if there were previous incidents or something that may have prompted action in the past, and then we'll pivot to some future thinking as well.
I'll say we did experience that heat wave in 2009. I remember it pretty clearly. But I think we didn't quite have some of the tools that we now have to measure its impact. For example, we didn't have a syndromic surveillance system in 2009. So I mean, had we had some of those tools, maybe some of these preparedness actions would have happened sooner. I think one thing that really did at least prompt some discussions on my team is a heat wave in Japan that was maybe in 2018 or so, where it was, just over 105 degrees for a really long stretch of time in a climate that was fairly similar to ours. And we read reports of people going door to door and thought, like, gosh, do we have capacity to manage the logistics of that? What would we do if something like that came, and could it come with a changing climate?
Absolutely. See if there are no other takers on that particular question. I really appreciate the question coming in to really reiterate that idea of continuous learning. I think going from that and looking now in the here and now, many of you noted calls from action or leadership support, highlighting attention on this critical topic and generally impacting your work positively. I'm curious, and a number of kind of initiatives that you all highlighted, from air conditioning programs and cooling centers, temperature maximums, et cetera. And so I'm just wondering, for particularly where there were calls to action, requirements, mandates, changes in policies, did you see increases in resources and support for that? Or how were you able to balance that? Some of you brought up funding, or we've had a couple of questions on those. And what about some of the competing priorities or challenges? It's great to get the support, but sometimes that can maybe put some unintended pressure out there. So if anyone wants to touch that topic, feel free to hop on in. I know it's probably burning on a few people's minds.
Yeah, I'm glad to jump in. I would say, absolutely. I think that with the toll that we saw in 2021 and the way that many people experienced that in their own day-to-day work and in many of our lives directly, I think really was a call to action. There's no question about that. The event itself, and then the high-level recommendations that came from our provincial coroner's office, which again, with these sort of extraordinary death review panels, really do gather a lot of attention. They are politically important, and we saw, I think, a lot of mobilization in terms of staff positions and resources to some of the recommendations that are described there. So something like a large program to deliver air conditioning units to different households, which I know have been seen in Washington and Oregon and other states within the US. We've actually looked to those as models. That's something that the funding of that, I would think, flowed directly from the events of the heat dome. I think it made the need very clear. As one example. So I think that the ability to communicate the importance of these events was definitely elevated. Whether or not we can carry that over to climate resilience in other domains, so preparedness for drought or flooding in our region, preparedness for wildfire smoke, I found that if heat is at the top of the page, that definitely gets more attention than some of these other hazards right now. And as well as that, always trying to look at how does this carry over to our efforts in terms of climate change mitigation as well. We have more attention towards some of the adaptation and resilience side, but really need to keep an eye on both sides of that coin.
Thank you, Michael. And I appreciate, as I work with undergraduates as well, sometimes you just leave a question out there and have to pause and see if anyone's willing to jump on it. So Jamie, I see you unmute. Go ahead.
Yeah, Resham, if it's okay, I would love to defer answering this question to one of my public health colleagues, Brad Kramer. Brad's on the line, and Brad has a better handle on the larger picture items. Okay, I see a thumbs up. So Brad, if you can.
Of course, yeah. And I'm Brad Kramer. I help to manage a climate and health equity initiative at the King County Health Department, the Seattle King County Health Department. And there was definitely an acceleration of resources and attention that came out of the heat dome, and that largely accelerated a lot of the activities that were already happening, but it did provide opportunity to be at the ready and to respond. And I'll give you some concrete examples, but be at the ready and respond. And then I think your question's key is sustaining that infrastructure beyond that. So like the the Seattle Council, I'm not going to get these specifics right, but the Seattle City Council did ask to have a heat planning session. Meanwhile, the King County was planning as part of this 5-year strategy to do a King County-wide heat strategy. And so that was already in the making. And then the City of Seattle Council mandate helped accelerate that or initiate that maybe. And we have more details on that as needed. But and also at the health department, we were forming this climate and health equity initiative. And so we already did have a small team at the ready to be helpful in the response, but then also with these additional resources and supports, we were able to grow that team and now have climate dedicated staff. What that looks like is we're not just addressing heat. We did that initially, and we were able to build routine data collection to support heat response. We were able to build a heat response plan. But now we're able to also do that for wildfire smoke and for extreme cold and flooding. And so we do have a centralized support team for the health department with climate dedicated staff that's continuing to grow that effort. And we can't do it necessarily at that accelerated pace. It's going to be a slow process. And so I think that's the pain, is just not, is that it's the pain point is just that we can't do everything all at once, but we're lucky to have that as a longer term goal.
Yeah, thanks, Brad. Appreciate that, and good reminder about building off of the momentum. Brendon, if you had a quick add on that, we can do that, and then we'll go to probably our last question here. But go ahead, Brendon.
Sure. I mean, I'd still think of it as kind of a surge of resources that came after the heat dome. But one thing that happened in the Oregon legislature is that between the 2020 wildfires and the 2021 heat dome, I think there was a general awakening. And how that played out for public health is that through the state's public health modernization program, local public health authorities were funded to have climate and health staff, very similar to what Brad's describing, that are responding and planning for not just response to heat, but a range of hazards, and not just responses, but general resilience and adaptation. The other thing that I think I've noticed is this proliferation of cooling resources that are available now. And I think one thing that's happening is that they're now available through so many organizations and agencies that it's hard to know where to direct people, and hard to make sure that that eligibility lines up with available resources. And so I would say at this point, navigating the available resources, the wealth of resources, is a challenge for us.
Thank you. Thank you all for those kind of forward-thinking remarks and the great questions. I think there's a few more questions that have come in that I'll try to actually one of our attendees helped summarize this, but on the piece of cooling centers, I think there's questions about thinking about cultural centers and thinking about reaching hard to reach demographics and your considerations there. There was a question earlier about regional coordinations and thinking about what kinds of spaces help with that type of exchange and how it's sustained or formalized moving forward. I think from my, another area of, given the work that you've all been doing, we started with who did you partner with, kind of thinking about who you're partnering with in the future, or who's still not at the table in the spirit of this collaborative mission and goal. I think our summary question for you all to consider is, would you like to speak to how much what your key takeaways will be from convening this group of partners from the 3 regions? So as we started bringing these 3 regions together, and a hint and a nudge that I know all 3 speakers and planning team members have said, this is just the beginning, and it's certainly not isolated to these 3 regions. But the question is, what are the hopes and the key takeaways from convening the group of partners from these regions?
I can go ahead and jump in, Rachel, to get this started, and maybe my colleague Brad might want to add a few pieces. But I think based on my story that I shared from the perspective of emergency medical services is that these are life-threatening circumstances, and we saw that. And there's not only the risk of illness and mortality, but also the risk to those who are caring for individuals, to the occupational health consideration. And so for me, the events of the heat dome really brought forth the urgency of making sure that this is part of our routine work and that there is dedicated resources and funding. And it's not just a one-time response activity that only happens when you get a weather service alert. So I think I appreciate that this collaborative exists and that there is dedicated conversation, and not just for a single county, but multiple regions, multiple countries. So really applaud this effort. And Brad, if you have anything else to add from our King County Public Health, please do.
I'll just say what I'm excited about is just that, we've already seen examples from the heat work that we would love to learn from. And so I feel like when we met in person, we complemented each other, and so we do have tools that we can share and borrow from each other. I was just most recently was Michael's presentation talking about the heat check-in support tool for folks who can get on the phone and talk to folks about what's happening in the heat. And so, but it's beyond the heat, and so I just think now we have a set of regional partners, and hopefully those in the room are finding that there's counterparts that are from Multnomah and from British Columbia, at least from my perspective, sitting in King County, but that you have a counterpart in those regions that is also doing this work. And so we hope to draw those connections. So next time there's a climate event, not just a heat event, we have folks to call on.
Thanks, Jamie. Thanks, Brad. And you have a partner over here in academia at University of Washington. And I think both what you bring up, Brad, and what Michael brought up earlier, and has been a theme from Jamie and Brendon of, as I mentioned, this is not just about heat, and it's thinking about maybe that's grabbing attention right now, but how do we think about this more broadly, and what are we setting up to kind of think about those types of partnerships? I'll see Michael, Brendon, if you want to add anything else on that. Go ahead, Brendon.
I think it's, getting to know my counterparts in Seattle and Vancouver has been refreshing, and I'm finding a lot of solidarity with them, and realizing that none of us really have this all figured out, and that's reassuring. But as Brad said, each of those jurisdictions has different strengths, and so we really do have an opportunity to exchange ideas, and all three jurisdictions come out with better preparedness moving ahead.
Yeah, related to that, I just had a similar experience of noting some of the strengths, and I've often applauded, I would say, environmental health surveillance in Washington and Oregon, and the work that's already been done around distribution of portable air conditioning. And it's positive for us to hear that some of our work in British Columbia is of interest. And to Bradley's point earlier, I really hope that can be the case for all of the partners that have joined, finding counterparts in social housing or in emergency management, and all of the different areas of work that people are joining from over the course of these the webinars and talks to come, and connections in between those as well, not just during the events.
Great. Thank you all. And I think that's just, again, a great question and great responses about where do we go from here. I'm going to invite everyone on the call to use the reaction button or throw out a virtual thank you for all of our panelists today. And from my perspective, thank you all for joining. Yes, thanks. A lot of round of applause for our presenters here today, and for really jumpstarting what I think will be a great conversation moving forward. As I mentioned, we wanted to dedicate a little bit of time for these breakouts. I'm had a hard time kind of cutting off the great questions and answers. So it won't be a ton of time, but we will enable the breakouts here. So if you'd like to have a follow-up question with Jamie or Brendon or Michael, or whether it's based off of the region that you're part of or something that they brought forward that you wanted to learn about, you can. For those who need to sign off, we totally understand. We're going to throw in the chat the link for the next webinar on January 18th. And we look forward to your feedback via the questionnaire that you'll get following this. But we'll try to keep the breakout rooms open for at least 5 or 10 minutes, as long as the speakers are able to give us. We look forward to seeing you, whether you're part of, again, just today's activities or in our journey together. If you'd like to learn more about the collaborative or partnering with University of Washington, I'll stay here in this main room. And otherwise, it's been a pleasure. Thank you all for joining us.